Michael Talbot here. I'm back from the Society of Robotic Surgery meeting in Orlando last week. I was there giving a talk on robotic gastric bypass, and it's really exciting to see all of the platforms that were available. There's about 40 robots at least in use clinically around the world at the moment, and some of these will be coming to Australia shortly. In this video, you'll see some of the robots that we were looking at, which include multi-port robots. So multi-port robot is one that has many different arms. There's single-port robots where there's a single incision that has a whole lot of arms coming out of it, like a hydra that allows surgery through a single incision, and platforms that are for all different types of surgeries. So what is robotic surgery? It's a type of surgery that uses digital tools to improve steps in surgery. The robot doesn't do the procedure, but it provides assistance. What it does, it improves movement accuracy and stability, improves vision for the surgeon. It improves the ability of the surgeon to get into difficult spaces. It reduces mental and physical fatigue while doing procedures. And it makes some minimally invasive procedures possible whereby open surgery would otherwise be needed. Overall, it increases the access of patients to treatments they otherwise may not have been able to get. And some of these improved access characteristics include things like telemedicine, where it's possible for surgical teams in different locations to work together to provide care for a patient. So if somebody's in the country, in a smaller town, big city doctors can be employed or engaged to help with the care of the patient. Also, there's digital tools that can be used to guide surgery, so we can integrate CT scan and endoscopic images into the surgical procedure and know when we're working where problems are, especially with tumour surgery. It's clearly significantly faster to recover from keyhole surgery than an open procedure. And we know that in many cases, if patients have a choice between an open operation with a big cut or nothing, they will often choose nothing for some procedures. So minimally invasive or laparoscopic or keyhole surgery has made a lot of surgical procedures accessible for people with a range of illnesses, and robotic surgery is a significant improvement over standard laparoscopy. There are some concerns about robotics. Because there's limited access, most surgeons don't use it. However, what we know is that when it becomes available, more and more do. For example, in the USA, more than 50% of the abdominal procedures that I perform are now being done robotically, and these numbers are going up every year. Once people start using the robot for procedures, they tend not to go back. Because robot surgery is reasonably rare, it's more expensive, and many hospitals or insurers don't want to offer it to patients. So private health insurers are certainly beginning to be more happy to allow their members to have access to robotic surgery. In some hospitals, this doesn't happen in public hospitals. The gap in care, therefore, provided to public and private patients is growing in Australia, and this is compounded by the fact that training surgeons are not able to be trained to do operations that they need to do as specialists. This is a bit like preventing airline pilots from training on jets, but expecting them to fly them when they become captains. Where are we now with robotic surgery and general surgery? There are a couple of different robot platforms that we use for abdominal surgery, and these platforms are shared with gynecology, urology, and ear, nose, and throat surgeons. There's also a whole host of orthopedic robots that have transformed joint replacement procedures over the last few years, and robots that assist in cancer diagnosis and treatment, as well as numerous specialised robotic devices that are improving medicine and surgery in sometimes miraculous ways. Which robots do we use in which procedures? I currently use the Da Vinci Xi and the newer Medtronic Hugo platform. I performed Australia's first bariatric upper GI procedures on the Da Vinci system, and also the first use of the Hugo platform for several of these procedures in ANZ as well. There are some operations where, in my mind, laparoscopy and robotics are similar, but there are procedures where I would want robotic surgery rather than open surgery or laparoscopy if it were me or my family. These procedures include halomyotomy, redo surgery for reflux or hiatus hernia, and some redo bariatric procedures, large abdominal wall hernias, and cancer surgery on the stomach and esophagus, but there are others. Many patients who have been turned down for laparoscopy surgery elsewhere could also have their procedures done on the robot on occasions too. The last couple of robots you've been seeing on the screen here are single port robots, which allow operations to be done robotically through a single incision. This is a really exciting field that promises to allow us to do things that we've not been able to do in the past, including complex telesurgery. What you're about to see next is a video of surgical instrumentation being used in space.
And hey, robotic surgery, excellent. It looks like she's already got the locker inside the locker location and is already working on installing it. Robotic surgery, can you see the video?
Robotic surgery here. We think we're ready for you to enable the payload.
Well, that was a surgery out of this world, right? So, huge leap for surgical history.
This will change the way telesurgery can be done on planet Earth, not only in the space.
It's a great day for medicine. It's a great day for robotics.
Hi, Pro. Robotic surgery here.
Congratulations to you guys.